Good morning students. Today we are here to attend the sixth and final lesson on arterial blood gas analysis. Okay, this is the part 6 of acid base balance. Before that we had 5 classes. Okay, and I hope you have attended everything because we are trying to understand the competency 6.8 fully. Within competency 6.8 we have covered everything. We have covered how to analyze ABGs mainly. But before that we also covered how pH is normally maintained in the body by lungs, by buffers and by kidneys. Okay. However, we just read how we can diagnose arterial blood gas analysis, I mean the acidosis alkalosis disorder. We have read something about compensation, and in the last class we have understood what is full compensation and partial compensation. Okay. In today's class, we will extend our conceptual understanding to anion gap, delta gap and urinary anion gap. So, what are those and what are their importance? Okay. So, needless to say, we are continuing with our competency 6.8. Just see, only one competency. Okay. You know what, competency 6.7 also deals with this. See, describe the processes involved in maintenance of normal pH. Okay. So, competency 6.7 deals with normal pH maintenance and competency 6.8 deals with the application, that is the ABG analysis. Fine. So, these are the steps based on which we need to analyze an acid base problem in detail. Okay. Okay, let's see first. Number one, what is pH? Okay. Given a problem, you need to first analyze whether the pH is low, that is it is in acidotic range, or it is high, that is in alkaline range. So, either acidosis or alkalosis. So, acidemia or alkalemia. Okay, that is the first thing. So, 7.35 to 7.45 is the normal range, beyond which we will go into abnormal pH category, right? Next, what is the primary disorder present? Okay, we have learned together what is primary disorder, how to identify. We need to look at the direction of bicarbonate and pH. If they go in the same direction, primary disorder is metabolic. However, if the pH goes in reverse order with the PCO2, which is usually the case, then the primary disorder is respiratory. Okay. Next, we learned, is there any appropriate compensation? Okay. So, appropriate compensation, definitely the respiratory disorder is compensated by metabolic way and the metabolic disorder is compensated by respiratory pathway. We told you that the factor that is not contributing to the acid base disorder, that is which is not primary, is usually the compensatory factor, right? So, if the pH range is made up, brought back to absolutely normal level, it is full compensation. And if the pH is still not normal, but it is in the process of compensation, it is partial compensation. If there is no change in secondary parameter, it is no compensation. Okay, so we discussed till here, right? So from the next line, that is point number 4, 5, 6, 7. Okay, these are all nice to know areas. Okay, it means if an average mediocre student, I don't want to claim anybody to be mediocre, okay, but if you just want to pass and if you know till here point, the first 3 points, you are well done. Okay, you don't need to watch this video, in fact. Okay, even if there is problem internet connection, if video stops, doesn't matter. But for those who want to score good marks, that is number one, and for those who want to diagnose patients in the real world for real, okay, this will help you much. And trust me, if you remember this whole lesson that I am gonna tell you, the next 4 points, okay, even today if you go to ICU, you can simply wow your seniors, because many of them tend to forget, and we teach the same thing to PGs, to anesthesia PGs, to all medicine PGs, how to diagnose ABGs, okay, because we take class for many final year students as well. So this is a very pro tip that I am gonna tell you, okay. So let us now go into the further analysis, okay. But before going to that, we know that these are the 3 normal values that we have discussed till now. So 7.35 to 7.45, that is normal pH. PCO2, it is in millimeter of mercury, okay, partial pressure of carbon dioxide is always in millimeter of mercury. Bicarbonate, the concentration 20 to 26, it is in milliequivalent per liter. Okay, that is any ionic concentration, the unit is always milli equivalent per liter. Fine. Even sodium, potassium, all of them are expressed in this unit, MEQ per liter. Next, anion gap, okay, 10 to 14. And albumin, it's 4. Okay, it is in gram per deciliter, and this is also MEQ per liter. Okay, anion gap. Mind it, this anion gap value will vary from textbook to textbook. Okay, so I have taken from Harrison, that is the golden textbook of Gospel of Medicine. Okay, Harrison says this. However, in first year, your textbook may tell it differently, but you should stick to at least one textbook when you are answering. Okay, if examiner ever questions you, okay, fine, you got this, I mean, you know this one, which book? Then you must be able to say, sir, I have read from this textbook, it says this one. Examiner will even ask, okay, can you show me? Then you should be able to promptly show you. Okay, just don't take any data from the internet and then tell. Okay, I am telling you, my reference is Harrison. Forget it. So, and this anion gap value also changes depending on how you calculate it. Okay, I will tell you later. So just remember, till now we knew pH, PCO2 and bicarbonate. Now anion gap and albumin as well. Okay. So this is our problem. Okay. See, example. This is our example. A 65-year-old male. Okay, present with CKD means chronic kidney disease. Chronic kidney disease is a term that we will be reading much more when we are reading urea, creatinine, all those parameter analysis. Okay, so chronic kidney disease, CKD, presenting with nausea, I mean tendency to vomit. Okay, diarrhea and acute respiratory distress. These are his complaints. 65-year-old male. We ordered an ABG. ABG shows, this is written in slash. What are these parameters? The first one always indicates pH, the second one denotes PCO2, and the third one denotes bicarbonate. Okay, this is PO2, pH, PCO2 and PO2. Okay, the patient is on 50% ventilation. Okay, 50% manual ventilation. Okay, this is VM, 50%. Okay, this, on further analysis, we also ordered electrolytes. You can ignore this on 50% VM. Okay, this is basically a whole problem that has been taken from the USMLE entrance, but there are some importance, but not at your level. Okay, you can omit this. We ordered electrolytes, so sodium, potassium, bicarbonate, urea, creatine, albumin, everything was ordered. Okay, generally we don't need to order these to start with, but depending on how further you need to diagnose. Okay, because not only you need to diagnose the acid-base disorder, you also need to diagnose why this acid-base disorder has been created. Okay, so to understand why, what are the individual components what that can lead to acid-base disorder, these parameters they become essential. Okay, so just omit this. Step number 1. So for now, our important parameter of importance is, I mean our parameter of interest is this pH, PCO2 and bicarbonate. Okay, these three, we should start with these three. So step number 1, it can be done with this parameter only, pH. So what it is, what? Acidemia or alkalemia? Look at the spelling of acidemia. Okay, whatever. Acidemia or alkalemia, number 1, definitely it is acidosis, acidemia. Okay, because pH is 7.23. Right? So it is acidemia without any doubt. Okay. What is the primary disorder over here? Okay, if you have noticed clearly, the primary disorder is, just look at this one more time. This is PCO2 and this is bicarbonate. Okay, PCO2 and bicarbonate. This, if you look at this carefully, what is your diagnosis? Over here, pH is going down, bicarbonate is going down, and PCO2 is also going down. Since PCO2 is going down and pH is going down, the disorder is not due to PCO2. Definitely the disorder is due to bicarbonate, and PCO2 is actually the compensatory process. Okay, forget compensation. Primary disorder, these two are going down. So even if you forgot everything, just by looking at this chart, bicarbonate going down and pH going down, this is metabolic acidosis. Okay, definitely if you are utilizing this chart to find out, you are absolutely right, this is metabolic acidosis. Okay, so fine, primary metabolic, pH and bicarbonate are both going in the same direction. Okay, now let's solve some more problems. So this is an exercise for you, this is an assignment. Number one, okay, I will tell the answers, okay, at the very last. So your job is to don't note down these points. Okay, this is fine. Just give yourself 30 seconds to diagnose what are these disorders. Okay, so this is problem number one. Forget this clinical manifestation, iska bhul jao. Just write what is this, metabolic acidosis, metabolic alkalosis, it may be normal also, kuch bhi. So whatever it is, just likho. This is problem number one. I will give 30 seconds for each problem. Okay, there can be compensation as well, or there can be no compensation. Okay, this is problem number 2. 3. Next, I will be not explaining these. This you should be able to do till now. Just need to diagnose the disorder and the compensation. Mind it, even if the pH appears normal, it can be due to the fact that pH and PCO2 have gone down and gone up and it has been compensated. Okay, next, just write your answers 1, 2, 3. There will be 10 problems, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you will mark yourself. Okay, and I want to see this assignment. Okay, likhoge, you will simply mark yourself and then you will mark those cross or right and then send it to me. Okay, after I show you the answers, of course. Okay, I hope you are done with problem number 7. I hope I don't need to tell you which is going up and which is going down. Okay, in this case pH is going down, PCO2 is going up, bicarbonate is normal. Whatever, this is problem number 8. Number 9. You need to diagnose first whether the values are within normal range or it is high or low. उसमें ही half job खत्म. Okay, so last problem ये वाला. In most of them, pH may appear in normal range, but you should very carefully look at these parameters. pH normal doesn't mean everything is normal in the body. Okay. Fine. So this was your mini assignment, and we will be sharing the answers at the end of the class. Okay. So now let's focus. You need to pay a lot of attention. Abhi. Fine. So our answer to the first one was acidemia. Okay. And it was due to metabolic acidosis. Okay. That was the primary disorder. Okay. Compensation क्या था? Compensation में, since it is acidosis, the respiratory component or lung is trying to lower the acid by lowering its own acid. That is why, as a compensatory process, respiratory acids are also gone down. Is it clear? Lung is trying to decrease the acid load, that is why it is also washing out carbon dioxide. Therefore, PCO2 value is gone down. So we can say this is a case of primary metabolic acidosis with respiratory compensation. Okay. Yahan tak we can diagnose. Next comes whether the compensation, appropriate compensation, it means whether it is full compensation or partial compensation. Definitely, since the pH is still low, it is not full. Okay, full means the pH would have come up to 7.35 at least. So it is not appropriate. Question arises, acute or chronic. Okay, means sudden change in pH or the pH change is very slow. Okay, acute means sudden. Acute pain, sudden acute pain in tooth, मतलब अभी दांत में दर्द हुआ. Okay, sudden chest pain means just chest pain has just started. Okay, but what is chronic pain abdomen? Every day there is pain in abdomen, slow, low grade pain in abdomen after taking meal for a long duration, that is chronic. Okay, any disease over a long or anything over a long duration is chronic. Chronic problem means रोज का झमेला. Acute problem means problem has started just now. Fine. So this is the rule when we deal with compensation. Again, I am telling you, this is a nice to know area. Even if you cannot memorize, if you forget, there is no harm for you in passing. Okay, but examiner will definitely ask these once you answer very good and you are aiming for top notch marks. Okay, so this is important. So देखो, what is the rule? How compensation we calculate? For acute, okay, in case of respiratory acidosis, it will be compensated by metabolic component, that is respiratory acidosis will be component by change in, compensated by change in bicarbonate. So how the change occurs? For every 10 rise in PCO2, bicarbonate increases by 1 and there is a decrease in pH by 0.08. This you need to memorize. कोई formula नहीं है, simple, रटना है इसको. Okay. Now this is acute. What happens in case of chronic if the change compensation is very slow? For chronic, acute means sudden, over a day compensation has happened. Chronic means over weeks. So in case of chronic, if there is a slow compensation, for every 10 increase in PCO2, bicarbonate increases by 4 and there is a decrease in 0.03 in pH. Okay, this is for respiratory acidosis. If you remember acidosis, alkalosis is same for everything but not in case of these. Okay, each and every formula अलग अलग है. देखो, in case of respiratory alkalosis, if it is acute क्या हो रहा है? For every 10 decrease in PCO2, bicarbonate decreases by 2 and there is an increase in pH by 0.08. Okay, again रटना पड़ेगा. And for chronic, every 10 decrease in PCO2, bicarbonate decreases by 5 and there is an increase in pH by 0.03. Too much to remember, I know. See, these are all like mathematical formula and simple maths आएंगे, sums in MCQs, PG MCQs. So you, based on the changes in values, you need to first calculate. You need to have an idea whether the change is acute or chronic. यहाँ पे एक easy way है to remember. Even if you don't remember how much bicarbonate is increasing or decreasing, because it is actually remember 1425, but ये disease sequence remember करना पड़ेगा. ठीक है, 1425 if you remember, पहले respiratory acidosis हम लोग discuss की, उसके बाद alkalosis, and acute पहले आ रहा है, chronic उसके बाद. Okay, so 1425, 1 means respiratory acidosis acute, 4 is respiratory acidosis chronic, likewise. But there is an easy way to remember. For any acute disorder, for every 10 change in PCO2, you see the pH is changing by 0.08. And if it is chronic, when PCO2 is changing by 10, pH is changing by 0.03. This is true for both acidosis and alkalosis. Means PCO2 change in acute leads to a huge change in pH. Naturally, 10 के साथ 0.08. But if it is slow, the body adjusts. So 10 PCO2 का change in case of chronic leads to a change in 0.03. देखो ये increase हो रहा था, ये decrease होगा. Definitely the value of pH varies in reverse order with change in PCO2. Okay. So this is acute or chronic. This is how you diagnose whether the change is acute or change is chronic based by looking at the PCO2 value, bicarbonate value, change in pH, everything. Till now we just calculated whether something is high or low. How much it is high, that also is an important consideration when you are analyzing any ABG problems. Okay. So this was respiratory. Okay, ये तो half हुआ. What is metabolic? Again, you need to memorize. Metabolic is calculated by Winter's formula. What does Winter's formula tell us? It says the expected PCO2, okay, should be 1.5 multiplied by bicarbonate plus 8. Plus minus 2 is a correction factor. We can allow relaxation of plus minus 2. So 1.5 multiplied by bicarbonate plus 8 plus minus 2. This thing we need to memorize. Okay. This is the expected PCO2. Now definitely there will be a serum PCO2 value that we will get from the ABG. Okay. If the serum PCO2 is more than expected PCO2, mind it, here we are considering a mixed disorder. Okay. So compensation, acute or chronic के साथ साथ we are now going into territory of mixed disorder. So this disorder that we are discussing was metabolic acidosis. I hope you remember. Whether there is an additional respiratory component. In reality, when lungs, kidneys are at fault, lungs are also at fault to some extent. So if there occurs this scenario where serum PCO2 is more than expected PCO2, then there is additional respiratory acidosis. Tough hai, but you need to understand the concept. It means what? The PCO2 should have been decreased just to compensate the metabolic acidosis, but it has decreased, it has not decreased in such a manner. Okay, then there is additional respiratory acidosis. Just get this concept. This is the formula. If serum PCO2 is more than expected PCO2, there is additional respiratory acidosis, not just plain and simple metabolic acidosis. Okay, for metabolic alcohols it is very easy. For every 10 increase in bicarbonate, PCO2 increases by 6. Okay, for metabolic acidosis Winter's formula आता है, right? I know it's tough for you, but we need to move on because we are now aiming for gold medal, right? देखो, in this case, if we consider everything, okay, here expected PCO2 कितना है? Expected, not serum PCO2. We should look at the expected PCO2. It is 1.5 multiplied by bicarbonate. Bicarbonate in this case is 7 plus 8. Okay, that is 18.5. ये आ रहा है, which is more than the serum PCO2. Serum PCO2 कितना है हम लोगों का? 17. So in this case, expected PCO2 is more than serum PCO2. What we read if serum PCO2 is more than expected, तब जाके होगा additional respiratory acidosis. But here there is no such case. So over here, expected PCO2 is more than serum PCO2 means the correction, there is actual compensation. So there is no additional respiratory component. The disease is actually neat and clean primary metabolic acidosis. Okay. For majority of the students who are facing a difficulty to understand, I am telling you again, नहीं भी समझो तो कोई दिक्कत नहीं है. Okay. Over here, since we have covered everything, 90% complete हो गया. This last 15 minutes we will be discussing some nice to know areas. ठीक है, तो ये जान लो तो सही है, नहीं जान लो तो there is no harm. Okay, so remember, in this case, expected is more than serum, so there is no additional disorder, right? Next, we need to look at the anion gap. अब ये anion gap क्या है? Anion gap in serum. We will take a separate class on anion gap if needed. Okay, what is anion? What are the main anions and cations in the serum? The main anions in the serum are chloride, bicarbonate. Okay, and the main cations in the serum are sodium and potassium. Okay, but apart from that, why these are main? Because we can measure this. Okay, but there are few anions, For example, albumin has got negative charge, okay, and there are many such anions that we cannot directly measure. So what do? They can increase or decrease based on few disease process. So we get an indirect information about them, and they are always present. Okay. So what is the indirect information? Indirect information, we simply add sodium plus potassium and we subtract chloride and bicarbonate. So we add all the measurable cations and we subtract all the measurable anions. That gives us the value of unmeasured anions. So this value of unmeasured anions is actually the anion gap. This is the basic concept. Okay. However, the value of sodium is so high compared to potassium that even in few cases we can just do sodium minus chloride and bicarbonate. Okay. So depending on whether potassium is taken into account, this anion gap changes. Over here we have only considered sodium. Okay. Wherever we are taking potassium, the value will increase. Okay. So anion gap is actually over here sodium minus chloride and bicarbonate. So either sodium minus chloride plus bicarbonate, or if we open the bracket, sodium minus chloride minus bicarbonate concentration. Okay. And there is something that is known as corrected anion gap. What is corrected anion gap? Since albumin is also contributing to the anion level, we need to look at the albumin, that is protein value. We need to look at the protein value, and then we need to use this equation. So anion gap plus 2.5 in bracket 4 minus the albumin value of the serum. Okay. These are all formulas, my dear. There is no way to understand it conceptually. You just need to know, you just need to see, you need to write, you need to remember. Okay. Having all said that, okay, see, over here we don't need to correct albumin, because if you look at the first problem, our albumin over here is 4. So 4 minus albumin gives 0. So corrected anion gap is equal to the actual anion gap. Okay? So what is the actual anion gap over here? Since we have calculated sodium, chloride, bicarbonate, the anion gap comes to be, so an anion gap of 19 means it is high anion gap. Okay. High anion gap. Why high? Because the normal anion gap is 12 plus minus 2. Okay, so from 10 to 14. So 19 is definitely high. Acid base disorder, based on whether the anion gap is high or it is not high, it is normal, can be classified into two categories: high anion gap metabolic acidosis and normal anion gap. Okay, these are the reasons of high anion gap metabolic acidosis. We remember them with the mnemonic mud pilers. Okay, I will just allow you to pause this video and look at these reasons. Okay, we'll move on. This is mainly an MCQ, for MCQ purpose, because we will be given each of them and you need to mark whether which one contributes to high anion gap. Okay, similarly, normal anion gap, the mnemonic is Durham. Okay, there are multiple diseases, okay, and each of them you will be knowing in much detail when you go to final year. Okay, by the time you reach final year. Fine. So over here we now know, since it is a high anion gap metabolic acidosis, the reason should be anything from here. Okay, any one of these. So let us keep on diagnosing. Next we need to look at the delta gap. Now what is delta gap? Simple equation, the actual anion gap minus 12 plus bicarbonate value. Everything is available in our problem. Okay. So this adjusted bicarbonate, delta gap is the actual adjusted bicarbonate, should be within this range. Okay. If the delta gap is more than 30, it means in addition to primary metabolic acidosis, there is additional non-anion gap metabolic alkalosis. Very important, alkalosis. Okay, if the delta gap is less than 18, okay, there is additional non-anion gap metabolic acidosis, and if the delta gap is between 18 to 30, there is no additional metabolic disorder. Mind it, we have already diagnosed our problem to be high anion gap metabolic acidosis. Now we are trying to calculate if there is any additional disorder or not. So we need to see whether the delta gap is within this range or it is outside this range. Okay, if it is outside, if it is more than 30, means there is more bicarbonate, so definitely there is high anion gap metabolic alkalosis. Okay, if the delta gap is less than 18, okay, it means there is additional non-anion gap metabolic acidosis, bicarbonate is low, and if it is in between them, there is no additional metabolic disorder, we should be satisfied. So let us look at our problem. In our case, the delta gap comes to be 14, 19, our anion gap is 19 minus 12, and this is our bicarbonate value. Okay, so it is 14. So what is the formula? Which formula it should fall? 18, less than 18, it is less than 18. So we should search for reasons of additional non-anion gap metabolic acidosis. Okay, so in addition, there will be non-anion gap metabolic acidosis. So in this case, there is both high anion gap metabolic acidosis, as it is obvious from calculating the anion gap, and from calculating delta gap, there is additional non-anion gap metabolic acidosis. Okay. So, if you look at the history properly, look at the history, we can go further. Absolutely at the start, CKD presenting with diarrhea, and there is, at your level you don't know, this is a very high value of urea. So, there is high urea and there is diarrhea. So, if we consider both of them, what is coming forefront? High urea is the reason of this high anion gap metabolic acidosis. You see, uremia is a known case of high anion gap, and since there is additional non-anion gap metabolic alkalosis, metabolic acidosis, this portion, see, this is due to uremia. Okay, that's what I told. Additional non-anion gap metabolic acidosis, it is due to diarrhea. Now it may appear very tough for you, but once you memorize all these reasons, and by the time you become an intern, you need to memorize all these reasons, then it will become very clear. The moment you see something, you will start thinking of all of this, and if there is any history of the patient, you will simply know that this is due to that. Okay. Lastly, most likely due to diarrhea. Okay. One thing remains, why we need to calculate urinary anion gap. What is urinary anion gap? Just like serum anion gap, it is calculated by looking at urinary electrolytes. So, urinary sodium, urinary potassium, urinary chloride. So, you add the urinary cations and subtract urinary anions. Okay. Generally, for normal anion gap metabolic acidosis, you see, these are the reasons of Durham. There is a renal component. Okay. And there are multiple metabolic components or GI components. So, kidney or due to gut, right? We know that both can lead to metabolic acidosis, non-anion gap. So, if we calculate the urinary anion gap to be positive, it is a renal problem, and if urinary anion gap is negative, it is non-renal problem. Okay, mostly GI. So, this is the end of our lesson of ABG analysis. You need to look at this website. You can just note down and type, okay, abg.ninja/abg. You can try out your skills. I have searched this website, it is very good. There are multiple such MCQs regarding acidosis and alkalosis, and you can really test your understanding. And this is the assignment which I just gave you in the class. So take the screenshot, or you can just mark it right now. So first one was normal, second one respiratory acidosis, third one respiratory alkalosis, fourth one metabolic acidosis, fifth one metabolic alkalosis, sixth one is compensated respiratory alkalosis, seventh one is respiratory acidosis. The last three are compensated disorders. First one was, eighth was respiratory alkalosis, ninth respiratory acidosis, and 10th metabolic acidosis. Alright. So I thank you all for patient hearing and being with me for the last 5, and I hope for this 6th class as well. If you have followed me for all the 6 classes, and if you are here till now, okay, I need you to type this word compensation in the comment section. If you type compensation, I will know that you have watched this video till now, and I can trust you that you have understood and you will perform quite well in all the MCQs, in all exams upcoming. Okay, so I'll see you in the next video with some exciting topic. Till then, bye and take care.